know what we should provide going forward. So we are continuing on that way very soon. We will engage the senior advisory group and we learn what we need to know.
In terms of today's agenda, is there a motion? Second. Discussion? All those in favor? Aye. Opposed? Motion is carried. Approval of October 18 minutes.
I move to approve.
Second. Second. Discussion?
The one item for clarification related to chair's comments. Mary's got notes there for us to just clarify the order rights. It's based on agenda, this came next. Just a sequence issue. Yeah. Just on the
Any discussion? All those in favor? Aye. Opposed? Motion is carried. Okay, jumping back to committee reports for the board members that looked in after 1 o'clock. Public comment, public comment, IPMO, the Sunday school, plan update for the next board meeting. So we're going to jump to finance and audit committee.
We had a meeting today. We had quorum. We did engage with CW and Associates to do our fiscal audit and tax return for Form 990 services for fiscal 2013 and 2014. So that we approved at the last meeting, and we signed it and sent it in. So we just reviewed that. We did select CW Associates. We also went over the quarter ended September 30, 2013 financial statements presented by Diane, our CFO, Diane, our CFO. She will be sending an email out to all board members to review. We did do a very in-depth review with her, and then at the next board meeting, she will actually do a presentation for everyone. So be expecting that in your email. Should be coming out today if it hasn't gotten into your box already. The next item is we discussed the Department of Health cost allocation and human service, sorry. Cost allocation and I always call it the MOVE, but it's really a MOU. It's a memorandum of understanding. Oh, it's good thing I'm Steve. I walked over. It's a little warm, so it's not used to it. So we did discuss that. The first one I'll bring up is the. We'll do the. You want to do the? You want to do the MOU. Okay, so the Finance Committee did discuss the MOU, and this is a payment that is required to the department. Let me get it. Give me a second. Do you want to go into executive, Director?
If we can get clarification from legal counsel, it would be appropriate on the contract item related to the MOU with DHS and or any of the other contract items. Those would be executive session or whatever. I just don't know what's
Yeah, it depends on what you want to discuss. We plan on discussing dollar amount.
I think we could discuss it. I mean, it's pretty straightforward, and it's a relationship. It's actually a positive thing. It's a good relationship between the Health Connector and Department of Human Services.
And technically, that'll be a public record once.
Yeah. So I don't have a problem with The connector staff members have been working with the department and trying to work out an arrangement to share information and just frame it, all the information that we're sharing, and I'll briefly run through the process. I'll share.
Sure. So for everybody here present, Centers for Medicare and Medicaid is sort of a parent organization that stems from Health and Human Services. And then it branches off into CMCS, which is where the Medicaid agencies lead up, and then CSIO, which is where the exchanges lead up. There's a requirement under the grants where we do, where if there are Medicaid beneficiaries that are being serviced as part of an exchange function or something that's a Medicaid beneficiary solely being serviced by the Medicaid agency, the federal funds require that you do a cost allocation, a proportional share allocation based on the number of Medicaid beneficiaries using it. It's something they've used before. Exchanges have come in. This is a process, and I really love to hear the representing the director if you want to add anything. But it's a standard methodology that's been around historically for a long time. So, in order for our organization and the DHS to be able to exchange and acknowledge that requirement, there has to be a vehicle in place for us to be able to do that, and that's what the memorandum of agreement serves to enable. Is it's the vehicle for us to acknowledge that business relationship that's required by our federal partner.
So what we negotiated was taking some of our proceeds from the grant and giving it to the vendor to help write the interfaces to help bridge through.
That's touch.
Yeah. So the total cost of the total amount of expenditures, which is detailed out over here, is $1,166,000, and it's broken out into 3 different stages. So Finance Committee did talk about this, and this is actually a good thing. It's helping both organizations to work more closely together to get the information to flow between the 2 entities. So Finance Committee did vote unanimously, although Director Katie did abstain because she is an employee of the state, but we did vote in favor of recommending that this be adopted by the Board of Directors.
Any questions? Yes, do you want to add?
Sure.
Just to help clarify, just because I'm cognizant of the fact that some folks might not understand that part of the issue for Medicaid is the funds that Medicaid gets can only be used for the portion of the bill that is directly related to Medicaid. So the part that's being requested for payment by DHS in this regard is bills that they did that Medicaid is not going to benefit from. Therefore, it's strictly a connector expense, and therefore DHS is asking to be reimbursed for that. There are times where there's going to be overlap. In this particular case, I want to just make sure it's really clear that these are items that have been determined to be solely beneficial to the connector, but the work was done by DHS's vendor and DHS staff coordinating it. So just so folks kind of don't wonder why is it that the connector is getting the state back to them.
I wanted to also, on the heels of that, add and make sure this is everyone before, that we are overseen by the federal agency. We have a federal grants officer that all of these funds are restricted within our grant, and there was a very thorough process that had to be reviewed and approved by the federal grant agency before any of this activity.
So with that being said, because this expenditure exceeds $100,000, we need to have a motion to adopt this memorandum of understanding between the Department of Human Services and the Hawaii Health Connector. So I'll make a motion that we adopt this. If there could be a second, I'll second.
Discussion? All those, yes, sorry. For clarification, are the state representatives conflicted?
I don't know. I think
Yes.
they are. Yes.
Under our previous discussions with Florida, I'd say they are, since this has to do with payment to the state.
But if I was to add, the state member partners are in favor of it. So, yes, sir.
Just a clarification, was the work already done?
Is it done?
Some of the work has been completed, yes. The process of The process of review by the federal partners and the extensive documentation that's required means that the process, some of the work needed to be completed in order to keep the bill on time, but the payment is coming after because of the process of review and oversight by the feds. I believe this is the priority.
Yeah, is that
Yeah,
correct?
Yes,
Fine,
so it's
and
work
function
completed
configuration.
for.
So some of it's already been completed, yes, but we needed to move forward to make everything work out right.
And this is not the last one that we'll be dealing with. There will be more agreements with the district.
Because we need to coordinate with them. It's so critical to the connector's success. So, does that answer your question, Director?
So, just want to mention the quorum, and we have the.
Yes, we do.
Discussion, further discussion. All those in favor?
Aye.
Opposed, motion is carried.
You want to do the IT one now?
Actually, we should probably hold that one.
Okay. I believe that is all that we went through at the finance committee. Thank you.
HR.
So just, again, just for clarity or transparency purposes, Jim, can we at least articulate what we're looking at in executive session? In other words, what that contract is versus who it's for?
The matter has to do with the contract for services related to the design and implementation of the health insurance marketplace. And it is, since it is a contract with the vendor, and it will include discussion dollar amounts. So,
HR committee.
Thank you. The HR committee did not meet until last week. So I worked with the last week additional benefits to staff for the organization that we did the last week. And we implemented by the next year.
Thank you. Any questions, discussions? Next item, director's report. Well,
Thank you, Chair. I'm going to be leveraging some assistance in the course of this report by our Deputy Executive Director, Eric Albort, on metrics, as well as get to current portal functionality. We wanted to be able to do an actual enrollment so that folks can see an individual non-financial assistance enrollment. What I do want to say is that the exchange is up and running. We are accessible to people who need coverage, and we are serving the people of Hawaii. I want to also acknowledge that this has not been without issue. As expected, we've had a number of challenges, many of which we've talked about over the last couple of weeks, but one that we, like other states, are continuing to move forward to address in the coming months, and some of that will be described too as we go through the rest of the report. I want to make sure that I convey to the public that, I am responsible for the exchange. We listen to our consumers every day, and we receive feedback from you all via our call center, via our marketplace sisters. And I want you to know that we're working diligently every day to advance the mission of the exchange. The most important thing that I want us not to forget is there are people who are getting insurance coverage through the insurance marketplace. And so, we have 100,000 uninsured, and we're very proud that, we are able to provide that service to those who are captured in our community. What we're going to do is transition to sharing some early metrics with you, a little bit of background information. There is a mandatory reporting requirement by all of the exchanges and the federal marketplaces, and that first large reporting came out November 15th. The metrics are very confusing in how they are defined and interpreted, and so we wanted to spend a little bit of time not only with the board helping to clarify those definitions. The first one I'm going to go to because it's the one that we get asked a lot about is enrollment. Enrollment is defined as being an effectuated process. That means that someone actually completes their plan selection. They send a file is sent to the issuer or the insurance company, and then payment is made. So if you see a number on enrollment and it doesn't, and it's a 0 or whatever the number is, it doesn't mean that people haven't actually enrolled in plans. It just means that people haven't paid the money or that transacted file doesn't come back yet from the issuer. There is data out from when Massachusetts is one of the early prototype states for these health insurance exchanges demonstrated in their data. And this is coming out in the federal reporting as well. You will tend to see lower numbers of people enrolled, effectuated enrollments in the first month, and those don't start to surge up until they get closer to the deadline, largely because people are motivated to pay when it's the last minute where they have to pay. But what we want to do is we want to really help be as transparent as possible in explaining what all of these numbers mean. I do also want to say to you all in the public that we want to be accessible to the media as well in helping to explain many of the questions that you all have about these metrics, and we provide cell phone numbers to staff. So while there may have been comments made that we were not available for comment, we do have cell phone numbers out there for our staff, and we look forward to continuing to partner with you all and being as transparent and as responsive as possible. So at this time, what I'm going to do is turn over to Eric so he can walk you through the metrics that we have. And I think part of this process for the board is also for us to gain a better understanding of, what metrics are ones that you want us to report on an ongoing basis.
Thank you, Coral, Chair, members of the board. Good afternoon, everyone. So we, last board meeting, the board directed us to sort of go back, report out on some numbers, and then executive committee, we made a presentation sort of doing a deep dive on all the metrics and numbers. We're sort of going to continue to do that today. So share with you all of the numbers around what you help director knows, and then I think by the end of the presentation, the goal is to give you all some food for thought on what numbers that you would like on an ongoing basis, how frequently, and then what numbers that may be good to share with the public on an ongoing basis. So that sort of reflects what this is, what we're going to do with this piece, and just so everyone knows, we do want to get through individual enrollment as well. So there's a lot to digest here. I think maybe for the purposes of today's board meeting, I think I'll go through it. If you have questions, feel free to ask those, but just be mindful of the time because we have a demo to get through as well. So again, we're going to review the requested metrics. The board of directors asked us for a number of metrics. We're going to go through those. I thought it would be really helpful to kind of show people how individuals or small businesses, for that matter, go through the Hawai'i health metrics. So you can see what drives the metrics. It's really important to know that because if you don't have context behind the numbers, they don't make a whole lot of sense. Then we're going to go into deep dive into metrics, so give you all the data points, and then we'll go into some suggested metrics that the board can consider either today to make a decision on or at a future board meeting, however the board wants to proceed. So here's a list of metrics that you all expressed interest in, and so they sort of break out into a couple of different areas: the call center and the web portal. Of course, that's really where most folks are coming into. It's either through the website or picking up the telephone and making a call. The marketplace assisters, those are all the folks that are deployed into the field. And then, of course, the enrollment number, sort of what is at the end of the day, how many people are enrolling there. There's the public metrics, sort of how can we explain to the public at a high level what's going on, who's interested in the Hawai'i Health Connector, how are they coming in, what is their experience like, what is their average wait time, their average hang-up time, and how many people are out there able to help the community, how many Papua, how many on each island. Just to review, I think Coral kind of spoke to this, but just to remind everyone, we report to CMS our numbers, we report to you in the public our numbers, and of course our vendors report to us. Right now, here's the page that we have up on our website explaining what sort of numbers are out there. We talk in terms of what happens every week, and then we talk cumulatively. So for the week between November 3rd and the 9th, we had 4 Papua added, 2 certified application counselors. There was almost 11,000 unique website visits, and over 3,000 calls. And then the cumulative statistics are already listed below that. Okay, so here's sort of a discussion of how the architecture works, right? How do people come to the Hawai'i Health Connector? And what's the experience like? Well, first, the first scenario, let's call maybe the Medicaid first scenario, right? So there's someone that's interested in getting financial assistance, right? Whether it's tax credits or the Medicaid program. I think by and large, most people, when they're thinking about buying a health insurance product, they're going to say, okay, is anyone going to give me help to purchase, right? Is the federal government going to give me a tax credit? Or maybe based upon my income, I can enroll in the Medicaid program. So that person then goes to DHS and fills out the CALIA system application. Okay. Then they get to a point where, okay, are you Medicaid eligible or are you not? And if you are, you'll come to the connector. But if you are not, you also kind of come to the connector. So we want to be able to offer you coverage, right? Does that make sense, everyone? So we get that all in one file from DHS, and through the end of October, we had a total file case numbers of a little over 8,000. Now, a lot of those are applications that Medicaid has to process, right, or that they did process, and those are Medicaid eligible people. And the rest of those are really our business, right? The bread and butter of what the connector does. It's the people who get tax credits or who might be eligible for cost sharing deduction. And that file's had about 2,000, roughly 2,000 cases. Now, the way that file comes over, we have to work with our partners at DHS to make sure that information really works with our system. So it really is a collaborative process there. After that point, then they can come into our website. Okay, so then their file is uploaded, they're sent out a notice, okay, then they can go to our website. And what they do is they'll select a QHP and enroll. And so you can see that any individual in Hawaii who seeks individual financial assistance has to go through this process, and this is, if they just know that, they go to the DHS website first. Now, many people probably, turn on the TV, they see a Hawai'i Health Connector commercial, or they hear about it from their friends. They might come to our website first in this scenario, right? So they come to the Hawai'i Health Connector, but they still may want financial assistance. So if that happens, we either through the call center or from our website, we route them to DHS, because those folks still want financial assistance, and we have to route them that way. So then they get a determination on the Medicaid application, right? And then they go through the same process again. So any questions about the differences between those two? It's very much the same process, but I want to identify that in both cases, whenever anybody wants financial assistance, they have to go through the DHS portal. So here's for the Hawai'i Health Connector, the happy process, right? This is a person that doesn't need any financial assistance. This is a person that can just come to our website, pick a plan, and enroll. And between 10:15 and 11:09, there were approximately 1,600 folks who have gotten through that process and who can select the QHP. And that sort of wraps up the individual process. Are there any questions there? Does anyone? Yes, please.
Typically, how long time it takes to for a person to be approved to qualify?
Okay. So that's a great question. In some sense, I have to defer to my colleagues at DHS. Do you want to start, and then maybe I can supplement?
Well, by rule, we have 45 days in which to make the application. It's typically taking us, well, we've only finished October. As you can see the numbers, we did process about 6,000 applications that came in order to turn out. So there are some cases where we get an application, but we still need additional information. So those are pending, and letters go out to applicants asking them for additional information. So those might take a little longer.
Any other questions about the process? So I just think it's important to reiterate, anybody who wants financial assistance has to go through DHS first, and that's because they have their own connection with the Federal Data Services Hub. And that is the place where tax credits or Medicaid eligibility is as well. There's the MAGI rules, so for tax credit purposes, I should say more specifically, or any cost sharing reductions, that's the place that they have to ping to figure that out. So SHOP is another scenario that we wanted to show you that drives different numbers. There's sort of two levels of the process, so I thought it was important to break apart the employer process from the employee process. An employer goes into the Hawai'i Health Connector, they register their roster of employees, and then after they've done that, they select a plan, right? Are they going to select the 7A or the 7B plan? After that part, a notice is sent out. The employee comes in, the employee selects the plan, the invoice is produced, right? They get this is how much you're paying, and then that's completed and they're enrolled in that plan. And that can happen 30 days or more by federal regulation. Any questions on that?
If an employee is eligible for Medicaid,
What does that mean? There's a couple of different answers to that. If the employer provides coverage, they'll usually go through this process. If the employer does not provide coverage, then they can go through that process. There's two processes that actually go. Does that make sense?
I guess the question is, and maybe that's where you'll get to the next slide when we talk about the dependents of the employee, is because at some point that's where that actually comes more so in is which the dependents of the employee could potentially qualify for Medicaid, and that might be an avenue versus them being covered.
Right. For mixed family scenarios, you're absolutely right. Again, all of those cases will be routed to Medicaid. So just some sort of comparison, right? Different states, different numbers. Here in Hawaii, a population of about 1.3 million. 8% is uninsured, it's about 100,000 insured. As Cole was saying earlier, there's the numbers from Oregon and Colorado. They have about 7 times what we do in terms of uninsured. And then this, I'm sorry, it's too small probably for you to read there in your chairs. But it sort of discusses how different states have staged their rollout, right? So, for example, Oregon isn't really even doing enrollment or putting up their QHP or the APTC CSR part of their exchange until December 15th, right? All the tax credits, all the subsidies are. But they're taking paper applications, but their portal isn't even working yet, right? Colorado didn't come up with that functionality until November 6th. And then, of course, we launched our application on the 15th. So we had a contingency application where we were collecting individual small business information between October 1 and 14th, and then on the 15th, we launched the dynamic application, the application that you see that. So again, some numbers by comparison, with Colorado having seven times the uninsured rate that we have, we multiply these numbers, maybe by 7 as a sort of just a general rubric of interest or general gauge of interest. Just some comparative numbers there. Okay, so this is sort of the deep dive into metrics. I'm going to survey a couple of them and then just ask you all if you have questions. There is a handout. Feel free to let me know, and we can walk through any of the metrics. So this is a cumulative look at numbers through 11/9. When we met with the executive committee, I was through 11/2, so we had about an additional week. The first two on top that shows the individual web form applications of about 1,100 and shop web form applications of about 200. Those are what we collected between October 1st and the 14th. So those, we basically pulled that information. We sent a notice to those folks, hey, we saw that you were interested in the health insurance exchange or health insurance marketplace. If you want Medicaid enrollment, please go to the Department of Human Services. If you don't want any financial assistance, please help. We can help you fill out your application. You've already started the process. So we don't really count those numbers on an ongoing basis, mostly because we don't want to double count, right? We don't want to count somebody who's come in and then count them again if they come in second. Accounts created, we have about 3,900. That means someone's given their username and password. Accounts completed or applications completed or shop applications completed. That's these two numbers, 2,264 or 113. Just a note, of course, these include families, right? So somebody could submit an application. There could be 2 or 3 kids and a spouse. So it's a little bit maybe higher of an individual case number, which is what this is. This is the total individuals applying for coverage. Individuals eligible for QHP. That means not only have they gone through the Department of Human Services process and been determined for Medicaid coverage, but they've also then gone through our process, their residents, their legal residents, and been incarcerated, the things that we look for in order to determine whether they can buy a health plan, right? That's this number. And then we get to the enrolled in QHP. Yeah, please.
So from the 3,060 that's basically half. Who are somehow determined ineligible for QHP enrollment?
Not yet, right? So this could rise up to 3,061. What's happened between these two numbers is an individual has applied for coverage. They've gotten to the point where they may be QHP eligible, but they haven't maybe submitted all that information to determine QHP eligible and press send. Right? So it's just kind of walking you through each of the parts of the application so that you can see where they are. And this is the number where we sent them a notice, hey, come back, choose a plan, you're QHP eligible, you should enroll in coverage. Right?
Eric, can you just do that? So one of the things that we will invite anybody's sort of assistance or insight to is part of the goal is to be able to help a user to get through the application in one sitting. Right? So there was a meeting that was held at our office last week where, for example, BCCA offered some suggestions to say, a user plan book. So I think in the community outreach is, maybe it's helping people to know to bring all these documents before you come and you sit down and you register. So these are some tips that we're sharing among states as everybody's kind of learning how you work toward helping get an applicant all the way through the application as a goal, as opposed opposed to them getting and having pieces of it. And some of this is just coming as we learn about the consumer.
Yes, please. Just this is to confirm that the 113 under the job application or employers only, right?
Yes, that should be employers only at this point.
Do you have a sense of what the actual total number we could expect or would expect? Do you have a sense of that?
That was a discussion we talked about in the committee, I don't remember, and one of the things that I said is that one thing that the Hawai'i Health Connector is interested in doing is conducting that research so that we can understand really some of the targets that might be out there, right? So if you do a survey of the whole state, how many shop eligible people might there be? That was one of the action items we took out last year. We'll make sure we follow up and report back to you on that. So we're getting to the sort of final part of this. Sorry, there's a number here at the bottom. This 180 individuals. Now, if we were to get sort of a number that might reflect what enrollment is, this is probably what is referred to as enrollment, right? Because that means the person has gone through the entire process. They selected a QHP, right? And then they've basically sent that information to the issuer. That's through this 834 thing, right? So then the issuer has taken that information and then they send us a confirmation. Yes, we received this individual's information. And then the last part of that process is payment. Does that make sense to everyone? Okay. It sort of got stuck here at the bottom. It probably should have been put on the next page, but this is the unique website visitor. So that's 85,514 individual unique website visits, right? Not duplicating IP addresses. And then here's some additional statistics around our call center, our contact center, and our outreach and education efforts, right? So since October 1st, we've fielded almost 17,000 calls. The average time per call was about 44 seconds, so 3/4 of a minute. And then the average call handle time, how long we were on the phone with the customer service representative, that's about 8 minutes, 18 seconds. And then the abandonment rate, which means the percentage of people that drop off between these two figures is about 17.96% or 18%. The outreach and education statistics, those are all the folks that we have deployed into the field, right? This is the number of in-person assistants, 74, and then the certified application counselors. As of 11/9, that's 29.
The third thing I wanted to add, I'm sorry, is that HHS prescribes a reporting format that we have to use. And so because the way the architecture is set up, where our systems, we are not able to count the numbers of people who are Medicaid enrollees or Medicaid eligible. That information has to come to the HHS system. And so I think there was a question about why we were one state that didn't report certain numbers. It's because we don't have those numbers in our system to report.
And I'll probably go back to the architecture to kind of reiterate that point. It's a good one to think about as well.
I kind of talked about it, and like my other question, I don't remember where we got this. What's the methodology or the performance measures we're going to utilize for the in-person assistants? So from the board's perspective, it would be helpful to know, of the applications completed, how much of that is coming through the in-person assisters, how long does that process take, what kind of value added are people getting from each of the different islands, and then the second thing is, and we may have talked about this before, is how do we validate that no offense to the sisters, how do we actually validate that the information that's being shared and such is on par with our expectations?
Okay.
And Jennifer, you want to real quickly answered that. Well,
Well, we can go through the presentation if we don't answer questions. Let's invite Jennifer up to speak.
Sure.
If that's okay with everyone.
okay, thank you.
So, on your handout, you also have some numbers that says portal statistics enrollment numbers, and they're a little bit higher than the 180, the 226. What's the difference?
So which one are you referring to?
Portal statistics number enrolled.
Goes for 11:30.
Okay,
Okay.
so that's a higher number.
That's just a longer period.
Longer period of time? All
Yeah,
right.
so total statistics, the enrollment numbers, is that what you're looking at?
Yes, yeah. I was trying to get the difference between the 226 and the 180. But it
Yeah,
just
so
appears
it's-
to be a
So
longer
what we
period.
did there actually, in difference to this presentation, is this goes all the way through 11/13.
Okay.
So as of 11/13, 226 instead of 180. I mean, the trend you will start to see go up exponentially, right? The beginning trend is low because what's happened is people have had to go through that architecture process that we talked about. So we'll go back to that and I'll sort of get at what that number is. That's okay with
Yes, do you have a sense of, I know that the changes are brand new, but do you have a sense of what the industry standard is in terms of the cost and abandonment rate? Because I'm looking at the 18%,
Yeah.
do the math, that's like 2,000
Yeah.
abandoned calls. And so, do you have any sense as to, is it a high number, is it a low number? Where are we in terms of quality of that?
Sure. I think it's sort of a high number if we were to take a long view, right? I think that if we were seeing a 20% 4 or 5 months from now, we'd be really worried. I think, having been over just a month and a half maybe into operations, you're seeing a lot of maybe looking groups who are calling up and just seeing what it is and hanging up the phone or whatever that might be. But I think it's a statistic you're absolutely right to identify because it's something that we want to keep our eye on over time.
What is your standard number?
A standard number.
What is it?
I'm not a call center expert. I would expect you'd want it less than 10%.
They're performance.
Is it performance goals? It's in contract.
Yeah, we'll actually get to that, but I don't know that we have an actual percentage yet.
That's a question. There's something that came up in the meeting earlier today related to the number of calls that was going to the call center that were tracking for Medicaid versus tracking for Medicare. So it's a point about trying to sort of somehow break out. The reason numbers are relatively high on the next data, but they're probably under just trying to have a clearer picture as to what categories people are falling into.
It's a great question. And I don't think I have any of the metrics that I have today that can give you a direct answer. If that's something that the board is all interested in having us report on, I think that toward the end of the presentation, I sort of prompt the question, right? What would the board like for us to report on?
There is the no wrong door concept. So the no wrong door rate that the ACA set up is that people will come in one place. The same thing is happening with the marketplace sister organizations. They've signed business associate agreements so that they can also complete Medicaid applications. And so, we're leveraging resources to be able to support whatever circumstance it is that consumer is coming for, and people's circumstances change.
Right. So to go to Coral's point, I mean, you can go, to us, but there is no wrong door. We'll send the person to DHS, right? Whether it's through a phone call or whether it's instructing them or having them click on the link that goes to DHS. So what Coral's saying is while the architecture might take a little bit of time, right? Like they have to still go through DHS, get their determination, we get the file, it comes into us, and then we can have an individual select a qualified health plan. That might take some time, right? But there's still no wrong door for any consumer, to Coral's point. They'll still have a chance to enroll in coverage, whether it's the Medicaid program or whether it's a plan with this financial assistance or whether it's just a plan where the consumer pays 100% of the cost. So I'm gonna try to speed up in the interest of time. We got through the statistics. I just, the point was raised, what is the performance standards, right? So we do have performance standards not only with CGI for the purposes of all the reporting, putting together the data warehouse, all the time that they spent with us figuring out what metrics to report on, how often they report. This also goes for our contact center vendor, Maximus, which provides the metrics, some of which were identified, and maybe if Medicaid is a metric that we want to discuss, that might be an additional one, but there are these reporting requirements. So what metrics should we report to the board, or what metrics should we report to the public? I think these are the questions that really are important, we believe are important. For the public metrics, I think that what we want to do is we want to show how many folks are coming, what are they doing, and I think that these are sort of the discrete metrics that we feel would be good to report to the public, and maybe there's more.
We're discussing age, number who are being different ways.
Right.
That's important.
Right, so maybe not just number of kokua, but on each island. How many kokua are on Maui?
And reading by this one.
I think by districts as well. Okay. So that's something that I think we do want you all, and I don't know if it's maybe the best way for your committee to discuss and to provide some direction to us. We currently report, as we showed before, on a website, that those are pretty high level numbers. I think maybe there's some more detail that we can provide. And then these are sort of the metrics that probably would be best to report to you all on a monthly basis. And they include the portal, the contact center, the marketplace, and sisters organization. Those are really all the different parts of the whole right there.
So I would say that the availability of because of the website,
Right.
how
We'll report it on the website so anybody can see it. Go ahead.
often?
Well, it's already up. Now,
Yeah.
It's been up for, what, 2?
It's the same,
That
No,
list we've
well,
had.
not that full list, so that's the list that we're suggesting that could be put in addition to the one that we have today, I think.
Oh, weekly, but
Yeah.
maybe weekly.
We update it weekly, and the way that most states are eventually going to move to a monthly process, so I think one other question that the board might want to consider is when we move to a more maybe, longer period of time to sort of, so we can build some trend data. So that is it for the metrics. The only other thing I was wanting to maybe walk through is through the architecture and linking back. Do you folks still want to do that, or shall we move on? The question maybe first? Yeah.
Can I just get clarification then? So on the items related to the metrics for the board, is that something that's just going to be referred to another committee to look at? Because I still have my 2 items as a question of whether we're going to get that. I really don't want to discuss it now.
Encourage the speech modifiers to give that consumer information that they would want. Any other questions?
Thank you.
Thank you, Eric.
Yeah. So then the next thing was the portal functionality. And what we were asked to do was, what we wanted to offer to you all is to actually walk you through an individual non-financial assistance enrollment, so that everybody can see what it's like actually going through the website. How long does it take? What's the degree of difficulty? Just so we could start to mitigate some of the, information that's out there now, and we can help you on the seasons, like actually be able to enroll as an individual. We can't take you through the financial assistance side of it, as Eric said, because it goes through, a couple of systems. But our objective is to, again, try to help create a consumer experience for you, so you have a better understanding of exactly what the portal can do.
Thank you, Cora, Chair, members of the board, everyone else. Pete Devlin, and I'm going to walk through what Will just mentioned. And I'm going to go through it as myself, as if I were sitting in my house using my own information and decided I wanted a QHP through the connector.
One request, so when Pete goes through here, is going to use his social security number?
I'll just go like that.
Okay, good.
Yeah.
The reason for that is real person's identity has to be what gets transmitted to the state up to the federal hub for validating presence residency and other things. So if you don't do that, then you get a false sense of the case and the credibility.
Okay. So I'll just dive right into it. And I'll go to connecthawaii.com, which will take you to the home page. Contains introductory information.
And this is live.
This is live. I'm on the
Introduction.
public site of Connect Hawaii. There's probably a lot of other people in here right now. So I'll start off. I'll create a new account. And I don't currently have one, so I'll go to new user.
Are you in the capital? There. I would call the capital portal.
So I'll go to user type here. You have the employer, broker, navigator, individual. A login ID. And a password. Security questions. You can do whatever you like. Now register this account. I would say I already registered with that email. So it needs to be unique. There's a lot of validation in the application. So now, like in the other websites, I need to sign in again for security reasons. So I'm back on the homepage, under the individuals and families section, and I'll just proceed to apply for qualified health plan. Here's just a general information page about security and privacy, and the Hawai'i health connector. You're all agreed that my information can be used for eligibility determination purposes. Sure.
So on that first page where it asks you if you're interested in financial assistance,
Mhm.
if you check that, would you automatically get routed to the other system, or would you go through the process and do it first, and then you do decide, oh, and then you go on to get financial assistance?
So that question has actually been hidden, and people know I don't want financial assistance. There is information on the homepage that says if you would like financial assistance, please click here.
Yeah, I mean, that's what I'm talking about.
Yeah.
So when you want to home.
Yes.
That's,
If I
generally
click that, it
speaking,
would send-
I think the individual will go in. And if you ask them if you don't have financial assistance, there's a lot of people say, oh, yeah. So they're going to click on that button, right? And then are they going to be transferred over to DHS at that point? Or will they go through the process within the connected website first? And if yes, at any point in that process, they decide you'll need financial assistance, go back to the home page originally, check the one that says no financial assistance, and then go through just the connected process.
I'd like to take them over to DHS's website.
Correct.
Directly. And then if they decided they changed their mind, they could just come right back here to the account that they've already created. And then my basic information. And this is all, for the most part, information that you just know off the top of your head. I am the person filling out the application. And over here, you can see a breadcrumb, which shows your progress through the application, and you can go back and make changes if you realize that you put in something different.
Oh, I
Home address.
Yeah, you chose Hawaii County.
Oh, no, it won't. Yeah, you have to get address. So yes, the address is the same. No authorized representative. It should be somebody designated to speak on my behalf. So can I bring it back to the screen first so I can see? Okay, so a few other questions. I'm not incarcerated, not an American Indian or Alaska Native. Let's see the requirements that are related, check marks. And a citizen, and not naturalized or drive. This question indicates that there's going to be a check with the federal hub. You can see that that's occurring now. And as long as the federal hub is on, it should work. Back information, this goes back to our rates. So right here, in the news, it's all over the ads. Here's a final confirmation page where I can review my information. And as long as everything is correct, I'll agree. Sign that in.
That point about the federal hub, it's important for folks to know, we don't have control over the federal hub maintenance. There's a schedule that's daily sent out that informs us of various, they send it out in alerts from CMS, letting us know about federal hub maintenance. You all are watching the national news just like we all are. And that's a dependency that we have, and we do not have any control over the downtime of the federal hub.
So at this point, I've simply put in all of my information. I haven't submitted it yet. Once I do, it'll determine eligibility, go into so I'll submit that.
So is this, after you confirm, is that an application completed?
That it doesn't appear.
Yeah.
Ready to submit.
You can see that I've been approved. There was a successful call to the federal hub. I checked on my social security, lawful presence, your citizenship. And from here, I can go directly into plan selection and comparison. So I'll click select right over here, that will accept the results. And here's another familiar information page about selecting plans. Here on the comparison screen, which automatically brings up all the available PhDs sorted by lowest cost. There's different filtering options. You can also compare up to 3 plans side by side. And you can download the different plans information if you would like more detail.
So you can log out at this point if you want to study this more, and then come back later and pull up the plan.
Yes. And there's a whole My Account self-service section where you manage your information. So I'll select this Kaiser plan. Now that's getting added to my shopping cart, and I can also go back and select dental plans. They're very similar. You can compare, select the filter, and I'll select this first one. Here it displays my premiums. I'm happy with my plan selection. And at this point, I haven't actually enrolled in any of the plans. E34 hasn't sent out to issuers, and it requires me to go through this enrollment step.
Jen, can you explain the E34 system? Or leverage the issuer?
Sure, maybe. Oh, I'm really lovely. But essentially what happens is the enrollment file that comes from the connector to the health plan with all the necessary data and information to enroll into an actual plan. And then what we would do is create you as a subscriber with our system, give you a number, send you a card, and you get this kind of stuff.
Right. Here's a final confirmation page. My social is wiped out. Here's monthly payments. And once I'm happy with this, I'll sign one last time. Confirm this, and At this point, the information will go back into the system and be sent over to the issuer for processing. And they'll work with the issuer to handle payments and ultimately the payment. Here you can see a final confirmation page. And at this point, the process from application to eligibility determination, plan comparison, plan selection, and then enrollment is complete. And that's about 15 minutes.
Question, if after you've done this, you sent it off, and we have a budget December, and you wanted to change that, is that easily done?
You wanted to change your plan? Yeah.
Up to the very end, right?
And we've done a number of those that we call the contact center, and they'll help you out with it. Just so I can quickly show you my account. I'll just go down to things. So you give your insurance information. This will take you to the self-service page, which I mentioned before. Here you can see the enrollments. There's a My Applications tab, which shows what you submitted. My eligibility will show that I was approved for QHP. My profile, I can edit some basic information, such as contact preferences. My request to submit a question or a comment to our contact center. Perfect. So at this point, you want to finish.
First, to see as you shop for a plan, whether it's done for the network. Now, first, to see the network. See what's in the network.
The filter where you
They
go
would do
down.
that, yeah, go through and dig down into the details of the plan, and then I open, select the download details.
Oh, yeah.
It took me to Kaiser.
And you will get to see my product. Basically,
I haven't looked through all of them, I have to defer to the issuer.
Specifically, can you see the network? No. Can you see if your doctor is in the network? Yes.
Oh,
It's a little bit of a conundrum because if you watch it, your doctor, if you wanted to know how many specialists there were, you would not see that. Right? So all you know is that your doctor is participating in that network. I think hopefully that would be something that could be done later on. So I think people are, they're not just looking for their one primary care physician, they're looking for, you don't know, right? It's like, what's the network like? So it's difficult to answer your question. So if you determine if your doctor's dentist is in the network.
And I think that that's what that one opportunity within the community outreach committee forum is to, we've heard the public testimony, some sort of wish lists of things they'd like to be able to see as information or links on the website. I know from networking with other states and actually in speaking with a physician out in the community at a town hall meeting, he expressed that one of the most important decision points for people when they buy insurance is whether or not their medications are in a formulary, especially because there's some people the generics don't work and other drugs do. And so we've been, I think California has a prescription or some kind of resource book. Those are things we can add to the wish list, but I think what they were saying is that if patients were able to figure out which drugs are in the formulary, they could better calculate their out-of-pocket costs, which is really where, which is also a designing factor for them. So, again, I think those are things that we can strive for. Right now, we're very focused on just getting all of the rest of the core points up, but we certainly invite the feedback as we tailor the site to meet more of what we need.
So thank you for walking us through the individual one. Are we going to do the employer and employee one at all? And are those, or maybe I'll just ask, are those just as functionally easy to walk through as this? Because it took about the same time plus extra people. I'm just trying to get a sense, because where I've gotten feedback of concerns about functionality have to do with the small business side of employers going in and that kind of thing. You have a sense of?
It probably would take a little longer because you have to input your employees, you have to make sure you understand the Healthcare Act, and follow that. There's a few more features in that, but otherwise it's a equally smooth and quick process where you're approved immediately and you move on to the second.
Would you like for us to set that up at the next board? Yeah.
If other folks are interested, I'm the only one on. Just do the test.
How do you think about the process of application and then get ready? Once you get the application, how long before someone's enrolled?
Nothing sure is that.
You're asking us, oh, we enrolled. When I submit it, the daily dash file, for the individual will have 15 a month to pay their local coverage the following first month. So for January 1 effective date, you have to pay it by December. Any other questions?
Yes. We have to prove it. Motion to move in, and this is the second case. See what happens. Yeah. The DHS.
Somebody's leaving for this, you know, how long is the next time?
Any other questions?
Usually on the agenda, I apologize, I didn't mention it before. On the agenda, we sometimes have the state recording, and I know that, commissioners go to two things that I just realized that's not on the agenda. Will we have Tom or Steve up? Update us? Yeah, no, what you said.
Thank you. Thank you so much for the demo, appreciate it. We do, have a schedule over the next couple of months where we will continue to phase in functionality. When we say that, some of that functionality, like you're hearing even in the national and other state reporting, may not be visible to the consumer. Just an acknowledgement that the systems are continuing to be improved over time. One of the things, and I know we have a director talking meeting on the line, that he gave me permission to speak on his behalf to update you all, is that there will be on our website on the small business side, there's one calculation for prepaid where the employee's contribution is 1.5% of salary. Currently, the calculation is pegged to 1.5% of the premium, which could potentially have the 98.5% of the employer's contribution be slightly more than what they would normally pay. And so, because the DLIR has the regulatory responsibility for ensuring that employers are noticed that they have 30, employers have 30 days. Employers load their rosters, and then there's a 30-day period and 30 days for the employees to make their plan selection. We are expecting the timing of the correction for that 1.5% calculation to be coming in at the end of November. So we're going to be posting a notice on our website for transparency to acknowledge the responsibility of the LAR that there is a calculation here that's not calculating correctly. There are workarounds where the call center can be leveraged in the meantime for employers who want to enroll, and they can verify that calculation. We are seeing of the employers that currently are enrolling, they're choosing the 100% contribution anyway, so the 1.5% of the employee share isn't a factor for them. But we did want to let you know that that is one of the improvements in the system to make a correction to that calculation. It does not prevent employers from putting their rosters in or for employees to be signing up. They just wanted to make sure that you all knew that the calculation is tagged to the wrong variable right now, and that for the period of time beginning around November 27th through December 15th, which is the time frame to complete the enrollments for the plan to go into effect January 1st, they took a compressed time frame less than 30 days. So it's a notice, and more information is available either through our call center or through the DLIR. But again, we want to make sure we're being as transparent as possible. Director of Community Concern.
Director Takamina, are you on the line still? Okay.
I think, Carl said as well. I think Tom and Jim are working on the, sort of the final draft of the language, and we just appreciate the cooperation on this matter.
Thank you. Any questions? Last question?
Oh, it's just, maybe that addition if I could to the agenda was requesting that Commissioner Rachel do a presentation for the board related to President Obama's decision to allow issuers to have those people who have been sent notices of cancellation and he's made a determination, and I just want to make sure that's shared with the board. So, that's okay. Sure.
Good afternoon, Adam. Consider allowing individuals against markets to continue their current crimes. It really left up to the insurers whether we want to continue their plans or just continue with the person that don't release the plans starting November 1st. So I just wanted to advise the board that is a request that we for all insurers.
Any questions?
No, but I'm perhaps, because this is still fresh and everything, but from your perspective, is there a last dead date that you would want to hear from them by? Presumably there's review that you and your staff have to do. I wasn't sure if you thought about that.
It really depends on what the review is. For example, if one insured review this small business is going to July, first of 2013, they usually have to up to 60 days prior to July 1st of that to come in and implement it. President Obama's recommendation was really to allow people who currently are insured the individuals. For Hawaii, we felt that because of prepaid primarily and the small business impact, that following the president's suggestion would be the best course of action for our individuals before the request to the insurers. We would ask them to consider continuing to.
Okay, at this time, the public, we are going into executive session. We'll be talking about current sustainability session updates, as well as having an administration update on the contract. We're going to the compensation and performance, as well as governance and management overview. Thanks for being here.
How are you?
Doing well.
I just have to report out on the
Yeah, we're here.
So how are you? Nice to see you. I am. What have you been
Yeah.
Depends on like state of the but we're in negotiations. And our state yeah.
Do you want Ed White to stay here? We just actually had a person that came into the nursing home. They let us go by ourselves.
Secret, would you probably want to be here yourself?
But it always happens, right? That we have renegotiation. Yeah. Yeah. It's so sad. Our contract was over August 6th.
Yeah, that's fine.
The first time we're gonna meet is stay on this call. Because Washington State was almost, they're almost gonna rush. Other years ago. We're missing, yeah, we will, gotta be because it's even. It's just open for one in We're gonna open one in or another one. They're not dead. They're not.
Yeah.
I'll invite stuff there when it's on sale.
I have a car, you know.
Yeah, okay. Well, we should get out this.
It's cheap.
Is everyone here? Oh. Is the camera on?
Is there camera on? Oh, it is, okay, good.
Sound.
How about sound? Yeah. Let me just load it.